Welcome to Roadmap to Residency Evidence-Based Applications. In this video, we will be discussing about steps in outbreak investigations. So what is an outbreak? So in the previous video, we have seen that we need to define the cases. We need to find out if it is actually an outbreak. So outbreak is the occurrence of more cases than expected. It is a localized increase in the incidence of disease. For example, there were a disease incidence of 5 cases per year of some disease. Now, in this particular month of, let's say, January, there is a spike of 500 disease in a single month, then that should be labeled as an outbreak. How are outbreaks detected? We need to review and analyze our surveillance data. The clinicians alert the health departments to unusual events or clusters. We receive reports by patients or other community members. To investigate or not to investigate, there are a variety of factors to consider. First of all, we need to consider the disease, the health department resources, and the external factors that may play a role in the disease surveillance prevention of the outbreak. What are the steps of outbreak investigation? So the first step is to prepare for field work. We need to establish the existence of outbreak, and then we need to verify the diagnosis. Then we need to implement the control and prevention measures. Since we have diagnosed the disease, that okay, this is the disease that is occurring, we need to control that disease, and we need to also undertake preventive measures to stop the spreading or the development of disease in the normal population. We need to construct a working case definition. We need to find cases systematically and record information. We need to go through descriptive epidemiology. We have talked about the epidemiological principles in the previous video. So by now you know what is a descriptive epidemiology. We need to evaluate hypotheses epidemiologically. We need to reconsider, refine, and re-evaluate the hypothesis. We need to evaluate the lab or environmental findings. Then we need to initiate or maintain surveillance, and then we need to communicate the findings. There is verbal autopsy. Now, preparing for field work, we need scientific and investigative issues. For example, we need to review the literature first. We need to consult subject matter experts so that we have an idea what to look for in the community. We need to consult the laboratory. We need to think about the supplies and equipment that we have. There are other management and operational issues like designating a team leader, communications plan, travel, lodging, and transportation. We need to establish the existence of an outbreak. We need to try to determine baseline occurrence of the disease. We need to compare the observed number of cases to expected number of cases for a disease. As I have told you about the example in the first slide, consider other possible causes for increase in the disease occurrence. We need to verify the diagnosis. It is similar to verifying the existence of outbreak. We need to review the clinical findings and lab results, and we need to consult that with clinical experts. Then we visit or interview the patients with the disease. Then we summarize the clinical findings with frequency distributions. Line list is that we list the causes with demographic, clinical, and possibly laboratory information. We examine number of affected to determine if it is over the baseline. Okay, we need to establish the existence of outbreak first. Now, the first and foremost thing that we have been seeing since the previous video till now is that the most important part is we need to establish the existence of outbreak. There is no good in panicking and in wasting the resources haphazardly. We need to establish the existence of outbreak first. If it is not an outbreak, we need not to worry, and it can be managed at a local level. Then we need to examine the clinical findings and lab results. This will verify the diagnosis. And then we need to implement the control measures, which is determined by the clinical picture and may change as the outbreak continues. Example, we need to implement droplet precautions when outbreak of respiratory illness is reported. Okay, we tell the public to wear masks. Construct a working case definition. There is a standard set of criteria for deciding whether an individual should be classified as having disease of interest or not. It is not 100% accurate, and we use a broad case definition or the investigation, and in later phases, we revise it and we narrow down the case definition. Now this is done, so the case definition is broad in the early cases so that we do not have any false negatives. Then there are the parts of case definition. There is a clinical criteria, there is a laboratory criteria, There are restrictions by person, place, and time, and it do not include exposure or risk factor criteria. For example, the three or more loose stools episodes of diarrhea in a 24-hour period in a student or a staff member of school A with illness onset after September 21, 2010. Now, this is our example of case definition. Okay, now this is a very broad sort of case definition, and it gives us an idea about whom to do the surveillance, whom to identify as a case for that specific outbreak. So here in the same, you can see the different types of criteria that have been fulfilled. So the clinical criteria here is that it should be in a student or a staff member of school A with illness onset after September 20. Person restriction, okay, in a student or a staff member. So we can see in this clinical criteria, the clinical symptoms should be three or more loose stools or episodes of diarrhea in a 24-hour period. Person restriction is student or staff member. Place restriction is the students or staff member of school A. Okay, the school A is a place restriction. And time restriction is that it should be after September 21, 2010. Now, this was a typical example of case definition and case criteria. And once you have case definition and case criteria, then you can move towards the other steps of outbreak investigation as discussed in the previous slides. Thank you for watching. Keep studying.